What is the thing you teach them? How to enjoy 1 and 2. Enjoy solving problems. Don't look at it as a burden. Don't get up and say, oh my gosh, you know what I have to do today. Get up and say, look what I'm fortunate enough to be able to do today. Look who I'm fortunate enough to do it with. And so the behavioral piece allows us to get people through that mindset. So that's the first problem.
Welcome back, everybody, to another episode. Looking forward to this. Today's guest is Kronos Sprouse, and he's the president and CEO of Eureka Connect, and he is the co-founder of the Institute for Biomedical Entrepreneurship. Kronos has spent nearly 40 years in healthcare, biotech, and life sciences. He's taken companies public, built multiple ventures, and carved out a unique niche. He helps scientists, clinicians, and technical teams turn breakthrough into actual businesses. Through Eureka Connect, Kronos develops leaders, restructures teams, builds the behavioral and organizational systems that healthcare and science-based companies need to innovate in the real world. Essentially, he's the guy who helps brilliant people execute, which is an interesting topic that I look forward to jumping into, which is why Fortune 500 companies and major institutions rely on his framework. Kronos, did I get most of that right? I hope I did. Great to have you here.
Geez, Jerry, that was really nice. That was maybe some of the nicest words said about me in a long time. So thank you. Yeah, very pleased to join you today. It's excited to chat with you a little bit.
Let's. I'm going to jump ahead just from that introduction, because I always say it's an interesting thing. I was talking to an artist the other day. I was doing a session with him. He's a business owner, and he's an artist, and he's got a bunch of different businesses, and he had reached out to me kind of as a mentorship, and I was helping him out. And one of the things I told him that in my experience entrepreneurially, artists are some of the worst business people on the planet because they're so passionate about their art, and really that's not a good fit for being an entrepreneur, really, and running a business. I've experienced there. I have much less experience, but some working with doctors in particular, and I found that to be the same thing. So kind of maybe, I don't know, I'm going to generalize, but there's certain fields that those people are super smart. They're really good at what they do, but they're not very good business people. Has that been your experience?
I would say predominantly yes. And, if you look, why is that? If you're a doctor, just think about the path of a doctor. You go to, undergraduate, you're studying pre-med, you go to med school, you're preparing for, you sort of get a general introduction into medicine, then you pick up a specialty, and then you focus on that specialty, and then, you end up, doing your residency at a hospital. You're focused on patients. You're focused on care. You're focused on diagnosing someone. Where are the business courses? Where's an understanding of how do you raise capital? Where's an understanding of even understanding? They over time they learn about reimbursement. I'm gonna bill for this code. You've gone through a myriad of health issues in your lifetime. So Jerry has a heart attack, and I'm going to treat him for heart attack, and he has high blood pressure, and he has arrhythmia and a myriad of other things. When I see him, how do I charge for that? They start to understand that, but I would contend that they don't necessarily all understand the completeness of the patient journey. What led Jerry to their office? What lifestyle choices or genetic dynamics of Jerry have contributed to that? And then how do you create a business around this, trying to extend people's lives, mm-hmm. and build a business where, it's predominantly, it's hours, dollars for hours, right? It's that doctor has to see a patient. They can't leverage. It's not like you where you've got, a transportation company and you just add more trucks. You have more drivers. That clinician is predominantly generating their revenue from that interaction with a patient. And then, some of them get very smart where they buy their building and they figure out that they can start renting off space, and maybe, if they're a general practitioner, they bring in specialties and they have imaging in the building, and they have they have an orthopedic guy in the building, and they have maybe a cardiologist in the building, and they start to figure out that they can get more revenue by just leasing out space and, shared services and that kind of thing. But most clinicians, they're smart people that have never been put in leadership roles. And they have to learn how to not only understand the business dynamics, but the stuff that I do, predominantly on the Eureka side, that is, which is the behavioral side. How do you develop the behavioral characteristics of a leader?
Yeah, that's interesting because it's almost, I didn't really ever think about that. They're almost captured in what they do, and therefore they're limited in the upside based on the amount of hours that they can put in and the number of patients they can see.
It's not their fault. It's just the path of education, and we've almost made it taboo for a clinician to say, "Oh, I want to take some business courses." And
Right.
I have a number of friends that have gone back and gotten their MBAs because these are some of the brightest people in society. They just haven't been exposed to that area of thinking or that knowledge. And many of them that have become great business people, and there are a lot of them, have done so because they've made that investment in learning the business side, or it was natural to them that they just sort of picked it up.
Yeah, that's interesting. Let's get into your background a little bit so we can all understand who you are and what you do. So why don't you give us that quick little 5-minute elevator pitch on what it is that or where you come from and describe to us what you're doing.
Yeah, I grew up in the Pittsburgh area, a town called Peters Township, and went to a small liberal arts school, played sports, and studied business and accounting. Ended up working for Ernst & Whinney in public accounting when I graduated from undergraduate program. And then ended up at a very young age becoming the CFO of a healthcare startup, and then got promoted to CEO of the healthcare startup. Sold that off, did a stint with a consulting firm, and then ended up in the early 90s starting a company called Boston Market Strategies, which was my first really big company. That I had run companies previous to that, and I had been, I had equity positions, small equity positions in some of the startups, but this was the first company. It was really my startup, and I owned it and I had a co-founder, a partner, and ran that company for 20 years. And we did third-party payer strategies. So if you were a Pfizer or a Sanofi or one of the big companies and you were going to price a drug and launch that drug, you would come to us to figure out, well, how do we contract with the third-party payers, with the Aetnas, the Cignas, the Medicare, Medicaid? How is that model going to impact our ability to derive revenue and profitability from that asset? And so we did that, and I was responsible for teams. I wasn't directly involved with all the projects, but the teams that I oversaw and many of the projects I was on, we launched and managed over 400 products, where we had, sort of portfolios of assets where there might be a number of SKUs and different kinds of assets within a particular type of product, like vitamins or something like that, to therapeutics, to devices and diagnostics. So in that 20 years, I saw quite a number of things. And then we also did a lot of work around clinical trial process efficiency. So if you're going to get pharmacoeconomic data, Jerry, to sort of justify a pricing model, we needed real world data to substantiate those pricing models. So we ended up running those trials to create more efficiency in getting the data. And then we ended up working with large academic medical centers. So work with both private and public academic medical centers, helping them re-engineer and refine how they did clinical research. And in 2009, I started the behavioral science company with the idea that I really became fascinated in all the technology and science that resided within the academic institutions, and that the nature and the culture of those institutions isn't conducive to an entrepreneurial way of thinking. That you've got, it's much sort of in line with the question you asked me about physicians. If you are studying biology and you become a researcher in biology and you end up being a professor at, let's say, Ohio State, right? You understand biology in a deep way and in an academic setting, but you really don't understand what is the application of biology as it relates to treating Crohn's disease or, heart disease. And so understanding that you come up with a cure for heart disease doesn't necessarily mean it's going to be successful, because you could understand the biology of that cure, but you don't necessarily understand, well, how's it going to get reimbursed? And how do I even navigate the regulatory pathway to get it approved and get it into the market? And so I run the not-for-profit that you mentioned earlier, the Institute for Biomedical Entrepreneurship. It's another company I founded in 2016, co-founded. And that company is helping the entrepreneur, typically out of academia understand that journey. What is the journey? How do I take my idea and move it forward? And what you find that there are a number of people that don't understand that journey at all. And then there's another faction of people that think they understand it because, well, I've developed this cure and I've got some good data that it shows it's going to affect XYZ disease, but they don't understand that there are different business scenarios. And in the end, an investor's looking for an exit. How do you make sure that that asset that you're developing is going to attract the strategic that's going to give you the big payday and actually have the means to take it to market? Because it's expensive to take a drug through the regulatory process. It's expensive to market a drug that's going to cure, like the GLP-1s, for instance, right? Mm-hmm. So I'm involved in that process. It starts predominantly with the behavioral side at this part in my career. And then, I've got a network of now over 7,000 people, but I try to put the best resources around these projects. And that's what the IB facilitates. So that's sort of I think I did it in 5 minutes.
Yeah, that's perfect. And Eureka, one of the things that I wanted to get a definition on after looking through the website was it looks like it's focusing on leadership development, and again, everybody has a different definition of that, but we all kind of understand that. But there was a term on there that I kept seeing, behavioral dynamics. Give me some idea of what we're talking about. Maybe those two things are the same, but give me an idea of behavioral dynamics and then how that leads into or is part of leadership development.
Yeah, so, you and I, when we started chatting, right, before we started the sort of the official podcast, when you and I met, there's two things that we can control. We can control our relationship with each other, and we can control how we navigate the topic. And, you've already formulated in your mind whether you like me, dislike me, or, a month from now, you'll be like, yeah, I talked to some guy, I don't know. I can't even remember what the hell he was talking about. And you'll leave the conversation saying that was really interesting, or gosh, that was like pulling teeth. I couldn't wait for the thing to end. Or again, I really don't know what the guy was talking about. And so behavioral dynamics is through the series of instruments. What's Jerry's starting point? What's Kurt's starting point? What is it that we start with genetically or from a learned perspective that's going to shape and guide that interpersonal relationship that you and I will either form or not form, and how we'll navigate our interactions with each other? And by knowing that objectively, instead of me guessing, it moves the discussion much further along. It gets us to a relevant point of interaction where we can start to create more meaningful relationship, because I know that you're high energy. I know that you're dominant. I know you're competitive. I know you're disciplined. I mean, I know in one of your podcasts, you talk about the importance of discipline and health, right? Discipline's a genetic trait. You're not born with, or you're born with a certain level of discipline. And what I mean by that is that, think about the military, how many young people we send to the military. You have 2 sons, right, that are in the military, right?
I have one in and one going in, yes.
Okay, so are they both really disciplined?
No.
Okay, so they're going to go to the military and they're going to find discipline, because what happens is they're told when to eat, where to sleep, when to sleep, what to do, what to say, how to act. And if they don't do it, they're threatened with a brig. Mm-hmm. There's a harsh repercussion to not finding discipline. But we find many young women, men and women, who thrive when they're in that environment, but then when they get out, they fall apart because they don't have the discipline. They don't have somebody telling them what to do. They can't get a job. Of my 2 children, my oldest is highly disciplined. He was built for the Air Force. It was perfect for him. He thrived. He got promoted. My son, Max, not as disciplined, but because the environment gives him the discipline, he's very talented. My son, Luke, always used to say, as long as you get Max to the game, he knows how to play. You just got to get him to the game. And the structure of the military tells him when the game starts, tells him where he has to play, tells him how he has to play. So for him, it's been a great environment, and I encourage him to stay in longer because I think it will help him to develop learned behaviors that will help him to present as a more disciplined person, even though it's not natural for him. So I don't know if that helps you understand that behavioral dynamics is that I use my two of my children, to give an example of the difference in them, but how they sort of thrived in the same kind of culture.
And so you've come up with a way to measure that. I'm assuming, is that where the starting point, so people have an understanding of what they're doing, not unlike the the different personality tests that corporations will give that'll kind of give you an idea at hiring what kind of person you're getting. Is that what we're talking about to start with?
You got it. Let's just do a little role play. Let's say I've got your profile sitting in front of me, and I know that you're high energy. I know you're an athletic guy, and you've done a lot, and you've gotten your health really in order over the years. But before that, I would say you're high energy because all the businesses you've done. Mm-hmm. You've been highly active, and I would say you're probably highly competitive. Competing drives one's propensity to take on risk. So you've never lost at anything. You just ran out of time. Mm-hmm. Like you've had businesses that have failed, but it wasn't because of effort.
That's right. Yes. Right.
And you talk about discipline. So my guess is it does come natural to you. You expect people that work for you to deliver, get the job done, do their job. You do yours, they do theirs. You had talked about in one of your podcasts about your health not being good in your 30s. Had it been better, would you have been more successful?
Absolutely.
Right. And then we look at dominance. Dominance is the need to control. Well, you don't start all these businesses without the idea that you're going to control them, right? You didn't just start them and just walk away, right? You told me you have to fly back to Oregon every month to, put your finger on the buttons and make sure everybody's doing what they're doing, right? So that's your genetic profile. That's how you're hardwired. But then if I'm working with a leader like you, maybe I see social acuity, your social skills, maybe it's like a 44. Like you know how to build relationships, but you choose who you do it with. You don't let everybody in. So people around you, if they're not really in your inner circle, they have a hard time reading you. Gosh, he comes into the room and he's demanding and he's got a strong personality and he needs things done. And maybe your goodwill score is a 38, meaning you have goodwill, but you don't show it. Work's work. When I'm at work, I'm not the nice guy. People need to get things done. Now, for your audience, I'm not saying that I have your scores and this is who you are. I'm just sort of making it up as I go. Right. But if I were working with you as a leader, I'd say, look, Jerry, you're built to carry people. Your genetic profile's off the charts. High energy, high dominance, high discipline, high competing. But you're intimidating. You walk into a room and people are like, and because of the social skills, they don't know how to connect with you. They don't see the father. They don't see the guy that moved and his 3 kids followed him to a new place because they didn't have to go off on their own. They were like, no, I want to be near mom and dad. They don't see the guy that's been married for 35 years. Maybe at some point in their interactions with you but they don't see that side of you. They see this intense side. So as you bolster social skills and goodwill, what we call social acuity, you will improve your ability to connect to people more quickly. You'll strengthen that interpersonal relationship and you'll be better at navigating the situation. So and there's a lot more to it, but that's an example.
Yeah, and in the context, obviously, I can see the applications for that in, let's say, a more normalized entrepreneurial environment, specifically to on the medical side, on the scientific side. I could see where that could really be important. One of the friends of my family that we grew up with, he's died years ago, and he worked in tech in the early days. We're talking 70s and 80s, Intel and other places out in Oregon. And he had all sorts of patents and all of the all of the accolades, and he had invented all of these things. But you could hardly have a conversation with the guy, right? I mean, he was just so smart. He knew so well what he was doing, but he was the weirdest dude on the planet. He really could not operate in society very well, so he was off-putting because he was so awkward when it came to talking to people. But he didn't know that, right? He thought he could talk to people. So for all of his brilliance, he really lacked a bunch of the skills and the traits kind of needed, particularly in an entrepreneurial world. Do you see that a lot more there where this kind of behavioral dynamics can be applied to help bring those companies to fruition, those entrepreneurs, and bring them out so that they can navigate the complexities, which really is what entrepreneurship is all about, is, how well can you communicate?
Yes, we do see it. Our platform, I work in the biomedical just because that's my Rolodex. That's what I know. And that's where, and there's synergies with the IB and what I'm doing there and the companies I'm on the board of and companies I've founded. So I've sort of, found my swim lane. But our technology, I've done projects with Bank of America and UPS. We've done projects with other big companies. It's sort of industry agnostic. But to your point, where you have people that there's another genetic trait I didn't mention earlier, Jerry. It's called reflectivity. It's the creative side of the brain. And, think of an artist. How does Picasso come up with a certain style that is so unique? No one's ever seen it before, right? That's that high reflectivity. He's thinking in the abstract, okay, versus very low reflectivity where you're sort of like, think of your sales guy, see mountain, take mountain. There's a client, I've got a sales pitch, I've got a value proposition, I'm going to project that to the client, I'm going to do it over and over and over again, and I'm going to land deals and I'm going to move on. And don't distract me and don't get in my way. Mm-hmm. It's not an intellect thing. It's a creativity thing. How many times have you heard a song and say, my God, that's an amazing song. I wish I would have written it. Right? And so you find these people you describe, the person you described as being highly reflective, but think about how I described a physician. They become a victim of the path they were on. They sat in the lab, and you said this person created tons of patents, right? So let's say I know a guy that's created 200 patents. How many of the patents have actually impacted people's lives? How many of the patents actually are an integral part of a product that touches you and me? Probably very few, if any. So this person's highly creative. They sit in a room and they create intellectual property and they patent it. And then they probably move on. They don't commercialize it. They don't think about, no, maybe they do on occasion. But the point is that their time is spent predominantly on that technology or inventing technology or solving problems. And it's not about the interaction between other people, that facilitates them sharing that knowledge or integrating with it something else. So what we do at the IB is we try to get them to take what's in their head and get the right people around them so that if they don't have the ability to learn that skill set, the technology isn't lost because of it, that they don't obstruct the entrepreneurial process. And that's sort of where I play between the IB and Eureka Connect. Eureka gives me the insight into the person. What can I do to help Jerry move along the continuum? And then the IB gives me an environment where I can bring other people to help me in that journey.
Is it fair to say, what's the biggest bottleneck in biomedical, medical in general? Again, you've kind of alluded to it and talked about it a little bit. We all know how complicated it is. It's in the media every single day about insurance and how expensive it is and how many layers there are and how many complexities there are to it. So to a layman, it looks to me like it is the process that is the bottleneck. But it looks like maybe it could be the human behavior, maybe not necessarily, that is the bigger bottleneck, particularly for organizations, like on an entrepreneurial perspective, is always fairly fast moving and things got to get done quickly. That's really the antithesis, though, of what science is about, and certainly what it is for healthcare, I would assume, looking at it from the outside.
It's a great question. And as you alluded to, Jerry, astutely so, that it's complicated because it's multifactorial. So let's take what we do at Eureka is we say, let's just start with the person. Let's start with the simplest piece of the puzzle, which is nothing gets done unless people do it, right? So if I can make every person at a company a little bit better, then they're going to be better at doing, and basically three things. Number one, defining problems accurately, knowing what's the real problem in front of you. I was having lunch with a friend of mine who's a CEO, wildly successful guy, just a gem of a guy, just one of those, the best of the best, right? And he's retired. He's on the board of his biotech company. But we were talking about this yesterday, and I said, when I talk to CEOs and they're sharing with me their challenges, more often than not, they define the problem incorrectly. They just define the problem wrong. And so the example that we came up with, and this is crazy, you'll see this is, he said, well, if I'm on a subway and we were talking about having a, license to carry permit. Mm-hmm. And he goes, I've never shot a gun in my life. He goes, oh no, I take that back. He said he did in college. One time he shot a gun, but he's never had one. He's never really been trained to shoot one. And I told him that, all my kids grew up shooting when they were young. I grew up in Western Pennsylvania. And so we were talking about this whole idea of decisions. If you were on a subway and somebody pointed a gun at you and you had a gun on you, what would you do? Would you shoot them? And I was talking, I said the best way to defend yourself, always, if it's possible, is to run away. Don't escalate, de-escalate. Don't try to, because if you pull the gun out, now you've escalated. Mm-hmm. Now you right? Mm-hmm. So I said to him, I said, let's just change it. Let's just say you're walking down the street and somebody pulls a gun on you. I said, what are you going to do? And he goes, well, I don't want them to get away with it. And I said, okay, I get that. He goes, it wouldn't be right. He goes, society breaks down if we just let them get away. And I said, yeah, but what are you going to do? And eventually got to the point where he said, I'd probably try to not engage or try to, de-escalate it. And he goes, maybe even run away. So I said, what was your problem when you were faced with that person with the gun? I said, because you're telling me about society and the breakdown of society, and it's not right that this person gets away with it. But I said, in that moment, what's your problem? He goes, I only have one. It's staying alive. I said, you got it. Your problem is staying alive. So what we're trying to do with the behavioral stuff, Jerry, is get people to move away from emotional reaction, which my good friend was doing. Emotionally, he didn't want to see that person take advantage of him. And say, yeah, everybody's going to start with an emotional decision. But how quickly can we get that leader to think about what's the data, what's the rational decision they have to make, such that they can live to be another day. They can identify the person in a lineup, and the police can go capture them when they're not expecting it, and they can they can be brought to justice. And you got to live through the whole thing, rather than being that poor woman that was stabbed in the neck on a subway, and that's it. Right? So number one, define the right problem. Number two is know what to do. Take the right action. Is the right action to try to fight the guy? My buddy was saying, well, maybe I'm going to take a jiu-jitsu course so I can learn how to fight. I said, why? You're going to spend every Tuesday or 2 days a week going to take jiu-jitsu classes at the age of 65 for a fight that you're never going to want to get into anyway? Right. I said, why don't you just learn how to not get a torn Achilles and run better? I said, it's a better use of your time. And so he laughed. And I said, really? You're going to learn how to defend yourself at 65? Give me a break. And the last thing, I think, if you talk to your 3 children, what is the thing you teach them? How to enjoy 1 and 2. Enjoy solving problems. Don't look at it as a burden. Don't get up and say, oh my gosh, you know what I have to do today? Get up and say, look what I'm fortunate enough to be able to do today. Look who I'm fortunate enough to do it with. And so the behavioral piece allows us to get people through that mindset. So that's the first problem. And then, I don't know how much more you want me to elaborate on this, but the big problem is then there's just not enough good ideas that are successfully getting through the process. Let's take, in Pennsylvania, where I grew up, there are 2 large institutions, universities, that bring in about $1.2 billion a year in NIH funding. So $2.4 billion a year in NIH funding. And you can't name a drug that came out of any of those institutions that saves a life. There are things that have come out, but you can't name them.
Right.
Right? And so if you look at that $2.4 billion, what could Jerry have done in his lifetime with $2.4 billion in an investment? Right? And so it's not the yield, the outcome. People will say, well, they're doing basic research and they're doing things that are going to benefit mankind. I agree with that, but they're doing it poorly. You can't argue that it's being done efficiently and optimally. So we have to fix that university model whereby a researcher gets a grant to do research and there's no accountability. Did you prove that you can cure the cancer? There's no accountability, whether they ever do it or don't. And some do it, obviously, or we wouldn't have new drugs and products. But many, 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 many more don't. And so we have to fix that accountability and what the focus is early on in that basic research.
From an entrepreneurial perspective, which is what the podcast is all about, I appreciate hearing that. Let's dig down on that for just a minute, because I've always said about government that Jerry, the problems are they're too massive and it's too complicated. And I said, no, you don't understand anything about managing, building, growing, working. You don't know the process. The hardest thing to do for an entrepreneur is bringing in profitable revenue. In my early days as an entrepreneur, my first company, the first year, the first business I ever had, I did $4 million. Now, I was too stupid to not understand that was a big number. I just thought that's what everybody did. We went out, we sold, and then I did $8 million, and then I did $12 million, and then I did $14 million, right? And I'm talking in a transportation business, right, with a $10 to $12 average ticket. And so I didn't know that was big. I also didn't know about a little thing called profit as well as I should have, right? So I was able to sell easily. It just came so easy. The problem was when I had to look at the business and cut it back to $8 million to figure out what was wrong so I could get my hands around it. Turns out I was not selling profitably. Now I grew it back to 8 digits again, but I did so profitably. But it was a lot more work. And so my point being is selling is easy. Selling profitably is very difficult. And that's the whole cornerstone of what operating and having a business is. When you're the government, you just get the grant. You just get the money. You don't ever have to earn it. There's no connection to that cash. When you have to earn the money that you then spend, when you have to bring in that capital that then you then allocate, it brings a whole different dynamic to it that I think is disconnected, certainly from the government side. If all I had to do was spend money, with my experience, and I'm guessing you'd be the same way, would be, aside from the bureaucracy, would be some of the best operators the government ever saw. And so that's at the government level. This is kind of quasi-government you're talking about. When you're talking billions, that's real money. And it's almost like a quasi-government that the money is being distributed to with what seems to be almost the same approach to that money, i.e., if they had to go out and earn the money that they're actually using to create these things, I'm guessing that they would be a little bit more on it when it comes to actually creating something of value.
I agree. I think there's you've touched on so many dynamics in the equation there. They do hard work to get the grant. If I'm going to write a grant proposal, I'm a smart researcher that's figured out how to navigate the process for that particular grant and how to obtain that grant. The ones that do it are really good at it, right? But as you're saying, if I had to do something with that money that fed my children,
right, that
put the house over my head, that was where I had to produce a value proposition, not just a paper, not just publishing, but that thing that I created, the science I created, the product that I created, did something for humanity, that humanity was willing to give me money for that I created value on top of the 1.2 billion, right? Because no one would give Jerry $1 million and say, hey, here's $1 million. I want you to make me $500,000.
Yeah, right.
No one says that. They say, I'm going to give you $1 million, and then I want a 10 or 20x return on that $1 million, right? That's what an investor is going to say. If I'm going to take a chance, Jerry's a startup, and this is his first time, which many of these researchers are. So I don't know that we need to put that kind of pressure on a researcher to say you have to have a 10 or 20x return. But I think we have to say there's some point where you have to say this science isn't progressing fast enough to get to a return, and that we need to abandon it and move on to something else. And that's never done.
Yeah, it doesn't seem like there's a lot of
years working on stuff that never works.
Right, which is kind of the opposite of first principles. It doesn't seem like there's a lot of starting from the first principles and working their way up, particularly after all of these years and after all of the largesse, which really is the is the enemy of innovation from my perspective, i.e., how many more things would be created if we just started with first principles, the disciplines that you and I live by every day, and tried to create from that? Or is it, and that might be, is that too generalized? Is that my misunderstanding or not understanding what happens in the innovation space when it comes to medical and science?
I think that you have to take that concept of first principles. I think it needs to be an element of how we advance the science. I think it's something that we just don't do that as well as we could or should. And there has to be room for exploration and innovating where there's not certainty. I get that. I'm not saying that there shouldn't be, but I think that we far too often let people have way too much rope as it relates to that path, and there's never going to be a win. Yeah. Like it's you and I would look at it and say, look, dude, you've been doing this for 5 years. You haven't advanced it. I mean, I'm on the board of a company, and we had certain metrics we had to hit, Jerry. And we were making money, right? So there was sort of a, wow, we're getting more clients. And it's like you said, it's the bad client. It's the not profitable client. Mm-hmm. Because the client wasn't pushing us to up the quality that led to the metric we really needed to hit. And it really wasn't until, this is years of this, right? It wasn't really until like probably a year ago that the board said, bullshit, here's the metric. You got to hit it.
Yeah.
You got to hit the metric. And guess what happened? The scientists all figured it out and they hit it.
Right.
But we had never pushed hard because we'd sort of let them say, well, we're getting better and we're getting better. And we're like, no, September of this year, if you don't hit the metric, we're shutting things down. And lo and behold, they hit it.
Magical.
It was magic. Yeah. It's just magic. But so I think that there's elements of business that you and I are more familiar with that are part of that. I've always, since I was in my 20s, I've been running my own business. And I always tell people I get to eat what I kill.
Right.
It's just that simple. It's just, that's the way it is at the end of the day. But, and you'll get this, right? You have to feed everybody else around you before you get to eat.
Right.
Right? That's a business. Mm-hmm. The owner gets to eat last, not first, right? For a successful business, right? There are businesses where the owner eats first and then you end up running the thing into the ground. But you gotta have everybody that works for you eats first and then Jerry gets to eat.
Right.
Right. And so that mentality doesn't exist within academia enough.
It's almost like research for the sake of research. The research is the job, not necessarily the outcome.
Yeah, and then there's this whole culture around, well, if you even propose the idea that you need to learn to make money at it, you're compromising the research or the science, which is, it's disingenuous. Mm-hmm. That's like saying we're going to spend, if we had to survive on an island and you had these same scientists, would you say, okay, well, why don't you study where we might get food?
Right.
Right. And see how long you have to study, right? You have 7 days. The average person could live 7 days without food, right? Or wait, it's 3 weeks, right? 3 weeks. Mm-hmm. It's 3, 3, and 3. You can live 3 minutes without air, 3 days without water, and 3 weeks without food, right? So, if you're on an island and that's the equation you got to figure out, there's a time limit on it. And I don't think we put enough time limits on the science. So, and it's not the fault of the scientist because they live in a culture where that's just how you can thrive by just writing papers.
Right. It's a system. The system's broken.
The system's broken. It's not the people. These people are brilliant. Yeah. I meet them. They're great people. The shame is that we're not, as a society, leveraging what they can contribute nearly the way we should or could. We're not even, we have these great thoroughbreds in the barn and we don't teach them how to run the track.
Yeah, and that's terrible in and of itself. It's worse than that. We're doing that while pissing away generational fortunes, right? Just ungodly, unimaginable amounts of money while we're holding everybody back. So it seems, it's just the worst double whammy you could imagine.
Well, then it gets worse because then you have the drug companies, which are, they suffer from the law of big numbers.
Yeah.
Right. So you if you're a $50 billion company, the street wants you to grow at what, 12, 15% a year.
Right.
right? And then you have patent cliffs on your assets. So you're going to lose 2 or 3 drugs. You're going to lose $5 million in revenue because it's going to go generic. So you've lost 10%. You got to grow at 15. So now you got to find 25% growth in a year, right? But the number is 25. It's a $50 million company. So it's 25% of 50 million, right? So it's such a big number. So what companies do? They can't find new assets, so they start cutting corners and finding ways to take something that they can, get a government to buy it and,
right.
And give it out to everybody, mandate that everybody takes it. And then we end up with these bigger messes, right? Mm-hmm. Where we've generationally damaged people because but the CEO of the company and the leadership team, they're just like, well, if we don't, the company's going to fail. We have to do something. What are we going to do? And they grab the first thing they think they can eat and they eat it.
Yeah.
Right? That's the analogy. Right?
Yeah. That's a great analogy too. Let's change subjects here a little bit. I want to talk about innovation versus reality. So, I'm a student of business. I eat, live, and breathe it every single day. Elon Musk I just can't get enough of him and what he's done, and I feel fortunate to live in the same time frame that he does, so I can see the kind of things that he does, and I'm just fascinated by all of it. I have trouble though, again, because I'm just a entrepreneur from Portland, Oregon, living down here in Tennessee, separating fact from fiction. What's reality versus what is more science fiction? So there's a bunch of hype, obviously, in biotech. Before I ask the question, give me a 1 minute kind of definition of biotech. We normies hear that thrown around all of the time. Tell us what we're talking about when we talk about biotech before I finish my question.
So biotech is looking at, can we develop products? The traditional pharmaceutical industry is that we have this compound and we're going to test it to see if it cures disease, right? So we're just going to keep, we found this weed, and my dog ate it and it seemed to cure its infection in its mouth. So we're going to just test that and see, well, geez, if we gave it to people, what would it cure? If we rubbed it on the sore, would it cure it, right? So pharmaceutical was a lot of you find something and then you determine whether, and it became more sophisticated. Biotech is more, can we develop something? Can we develop something that's more specific, and can we use some of these new, more innovative scientific processes to develop a solution or a cure for a disease? So it's more of the engineering than the discovery, if you will. Does that make sense? That's sort of a layman's version.
Yeah,
of it.
so it's maybe a simpler term would be for the folks is not unlike what we do with plants, fruits, things like that, where over the years we've spliced them together so that they're prettier and they're bigger and they're more luscious in a way. Of course, that's been going on for hundreds of years. In a way, though, what you're talking about is we just kind of the same thing. We just repackaged it as biotech and brought in the technology side to go along with the bioengineering side, if you will. Is that fair to say?
Yeah. It's a different way of innovating and developing cures and solutions, right? As opposed to we find something and then we find out, does this thing that we found naturally occurring in nature, does it? I'll give you an example. For many years, you go into the jungle and you find something and you say, okay, if we tested this, would it cure the disease or solve the problem, right? And now I'm working with a company that does bacterial phages. So you have a bacteria that has been proven to be harmful, right? Like for H. pylori, for stomach ulcers, right? And so there's an overabundance of that particular bacteria that's caused the problem, right? So a bacterial phage is the opposite. It eats and feeds off of that bacteria. So you design a phage to eat a particular damaging bacteria. Okay, so that's the whole idea of bacterial phages, right? Mm-hmm. So that's where you're now designing and developing something because you've identified the problem, and if as opposed to saying, hey, I wonder if I rub this leaf on that problem, will the thing go away? No, we're going to engineer something because we know what the bacteria is. We know what the strain of bacteria is, and now we're going to develop a phage to eat that. And phages are very safe because once they eat the particular bacteria they were designed for, they die. So you can't overdose them.
I see.
Once they run out of the food that they eat, and they only eat one kind of food, which is that bacteria, then they go away. And these things have been around for well over 100 years. It's just they weren't profitable, and they were really hard to develop or find.
So, and that might be one of the answers to the question where I was going now that we've defined that is, where do you see, separate some fact from fiction? If you've got an actual example, that would be great, where you see real innovation happening, the kind that, what's going to jump from the lab. We know a lot of things happen in the lab into the real world that you see happening here, either going on right now or maybe in the near future. Great
question. Let's just say that let's start with the premise that AI, and I believe along the lines of you and from what you're alluding to and Elon Musk, that AI will be better than not. Meaning it'll be a great resource to society and to mankind, to humans. So let's assume it's going to provide more good than bad. But there will be people that use it for nefarious purposes, which is why there's the fake videos and the stuff like you're saying. How do you separate the real from the fake? But let's take a standpoint of disease, progression of disease. We can take a group of people that present with a disease, diabetes, and we can look at their medical records. Okay, and the medical record isn't exactly dictating what happened to that patient, because a medical record is developed because the physician's trying to figure out the fastest way to put the information in and the way they're going to get reimbursed the most. So the medical record isn't always exactly saying what happened to Jerry. It might be close, but it's not exact. And what's going to happen with the new technologies, new diagnostics, new ways of measuring disease and monitoring disease is that you're going to be able to determine what in that medical record was not correct or accurate. Because now I've got this sensor that Jerry wears around, and it's monitoring his heart, it's monitoring his metabolism, and it's monitoring all these different things. And we're going to get a better understanding of the progression of Jerry's disease. And as a result, we're going to be more precise in how we cure that disease. We're going to understand with greater granularity at the individual level why Jerry's heart disease presents different than Kurt's, right? And so we'll move towards personalized medicine where we are providing, it's sort of what I'm doing on the behavioral side. I could walk in and teach theories on leadership. Every leader should do this. You should be disciplined. People should know your objective. You should know how to navigate to that objective. There should be timelines. There should be accountability along those timelines. But if you're not a disciplined person, and my discipline score is moderate, I don't have a big discipline score. I've managed my whole life through dominance and competitiveness. I can't stand losing, and I got to control the outcome, right? So knowing the difference between you and me, let's assume you're highly disciplined. I know that I need to put structure in my day. I needed to use time blocking. I need to make sure the things I hate doing are done first in the day. That's an intellectual exercise for me. For you, it's like falling off a log, right? So this AI is going to facilitate us bringing the tools to the human being and putting the right complement of tools around them, the right cure for their disease. It's going to make yours and my life more efficient if we use, and I stress the word, if we use the tools the proper way. If we don't, they're just tools.
Right.
Right? But if you figure out, let's say you've got a trucking company. Okay? In years of my lifetime, granted that you and I get to live a few more years, there will not be human beings driving those trucks. There won't. So if you're the guy that's got a trucking company and you're like, bullshit, I'm not getting rid of my guys. They're the best. I love these guys. Well, you know what? I'm sorry, but there's going to be an automated truck that can go 24/7, never gets in accidents, doesn't get tired. It's super efficient on fuel economy because it's watching every little sensor, right? It doesn't have a drinking problem. It doesn't have a drug problem. It's not overweight. It doesn't have hemorrhoids.
Doesn't fall asleep.
Doesn't fall asleep.
Yep.
Doesn't get lost. Doesn't get in an accident. You know, if you're the guy who runs the trucking company, you'd be stupid if you're like, I'm going to fight it. I'm going to keep my guys.
Yeah. Yeah. No, so essentially you're telling us kind of what we all know, which is that the AI and the impact that the AI is going to have, those wearables and those things that you're talking about, all of that too, I think it should be added, is we're essentially talking in real time. So there's going to be real-time updates. The AI is going to be keeping an eye on you, certainly with, the humans play a part in that. But not only do you know what kind of shape you're in and what's going on with your body, all of the history's brought together at one point, but it's all updated in real time, so you're getting that feedback as it's happening to you, which is quite an innovation, I would assume.
Yeah, and I love the example you just presented, because I'm working with a friend of mine right now. It's got a company, and it's a sensor, and it looks at certain biometric data points, and it's good. It's wireless, but it's not better than what exists right now. That I can grab a blood pressure cuff and take my blood pressure. Mm-hmm. It's not better than that. And I look at it and say, it's different. And it provides different way of capturing the data, and it provides different capabilities. But for me, the evolution is going to be something that gets blood pressure right all the time, every time, perfectly. Not something where you've got to be standing up and you can't be moving, right, and it's going to be on this part of your arm, and if it's not right on that part of the arm, it doesn't work. It's going to be something that some little old lady can put on her finger, and the thing is just dead on accurate every time.
Yeah.
That's the innovation that we want. And so I look at it and say, people will spend years developing that inferior technology. And some young kid at MIT is going to say, oh no, if I just take this little chip and put it in this LED, I can do the blood pressure thing and nail it. And I've got an algorithm that does it. And I'm like, okay, so those poor guys spent 5 or 8 years developing this technology they thought was better. And at the end of the day, it was...
Well, it can't happen soon enough. I have some personal experience with that. Again, I have something called hypertrophic cardiomyopathy. I have a 41% block in my left ventricle. I was born with it. It sat dormant. It popped up when I was 38, and it's been a nightmare ever since for me. And so once a year, I have to wear this monitor that I have to attach to my chest, right? And I have to wear it for 3 days, and it comes off when I work out, and it's a pain in the ass, and I can't sleep with it right, and it's, I sweat, and it comes, I live in Tennessee, so it's, you're going to sweat walking to your car, and I just think, I always say to my wife, it's like it's medieval times. I mean, I've been dealing with this back. I broke my back when I was a kid. I've had 17 surgeries, and so I've had all kinds of things attached to me. This thing's about as cumbersome. Okay, yeah, it's wireless. I still have to put it in a box and mail it back to them for them to get the information out of it, right? After plastering it to my chest. And I just said, is this the 90s? This is what it feels like. To your point, I think that's probably a real-world example of, it doesn't seem like we've come very far, because I still got to put it in an envelope and mail it off, which is probably just makes the least amount of sense to me in the world that we live in today. But as an example, that's what one of the largest hospitals down here in the South gives me to monitor my heart for 3 days.
Yeah, and it's incrementally better than what we were doing 50 years ago, where you had to go into the hospital and be in the hospital for 3 days. So yes, it's an advance, and it's a worthwhile advance. But to both of our points, it's not where it's going to go. And so I think every industry, whether you're in the trucking business or you're a cab driver or you're an Amazon driver, or you work at the grocery store stocking shelves, or I read somewhere now they can fully automate a McDonald's.
Yeah.
Right? Fully automated. Cashier, in Europe, you go to Europe, there aren't really cashiers. You put your order into a machine, you walk up and they hand you a burger, mm-hmm. right? And that's going to be a robot. Now, I bet you if I go back to France, it's probably a robot that hands you the burger. Mm-hmm. And there's probably a robot in the back making the burger, right? Mm-hmm. At some point, you're not going to have human beings in those restaurants. That's just where it's going to go. The question is, how do we retool people? I grew up in Pittsburgh in the 70s when all the steel mills came on hard times. And, a lot of those people never were retrained to do anything.
Right.
They retired or they moved somewhere else, and they, who knows? I don't even know. I have never really read a book on what the real, I know in my circle what people did. Some of the, people that were managers and leaders of the steel mills, they were able to find jobs in different industries and do things. But, what did the average steel worker do?
Yeah, that's we don't have time. I would love to have dove into that subject a little bit with you, because that's really interesting. The difference then to now is that, I'm a home builder, and I can't wait for a robot. I'm going to have 4 of them. There's a whole bunch of conversation in the world today about, in my part of the world, about what we're going to do with these humanoid robots when it comes to building, framing, and building houses, and that they're going to work. They've got to be charged for 4 hours a day, but they're going to work 20 hours a day. So instead of paying, $12 a foot to have a house framed, I'm going to have robots that are going to be able to read the plans, and then the equipment's going to be delivered, or the product is going to be delivered by a robot. And when the robot breaks, it goes away, and a new robot shows up and knows exactly what to do. So the cost, you're talking about $30,000, $40,000 robot. All of a sudden, you're framing 10 houses a month, and it costs you the electricity to run the robot, right? And the product is cheaper because it's delivered by robots. And when you buy it, it's cheaper because it's manufactured by robots. So there's going to be this whole, the price of everything is going to be so much significantly less. Theoretically, we're all better for it, unlike what happened in the 70s and the 80s and the 90s and the 2000s after NAFTA and all of those things as it hollowed out the middle class, particularly in the central part of the country. But, yeah, that's a conversation for a different day. But I'm fascinated by all of that, because I plan on, to your point, having trucks that are driven by themselves, and having builders in particular, kind of that kind of framing work and things of that nature that can be done. Plumbing and electricity is something different, but at costs that are going to be significantly less than what I got to pay the human to do it. So there's value in that to all of the humans, but what happens to the human not doing it? I don't. That's the interesting part.
Yeah, it's that's the thing we're going to have to figure out, and no one has an easy answer for that.
Right.
No one has an easy. But I contend the behavioral stuff I'm doing, if you can help somebody be better at building a relationship, defining and solving problems, you've inherently, just by helping that person become a stronger at those functions and dynamics of life, you've now enabled them to be able to do more, right? Mm-hmm. Because they know how, I was a crazy little scientist, and now the chemistry is being done by a robot. It doesn't need me to do the chemistry anymore. But now I know and understand chemistry, so I can look at the output from the robot, and I know what to do with it. And now I can communicate that to Jerry, and Jerry and I can come up with a solution that the robot didn't conceive.
Right. Yeah, interesting. In the couple of minutes we got left here, I like to do a speed round at the end of these interviews. So give me the quick answer. You're going to be the first person that I ask my first question of. I'm fascinated by AI. You brought it up. So I play pool. And I play pool at a town that's about 25 minutes away, 30 minutes away from where I live. And so 2 nights a week, sometimes 3 nights a week, I'm making this 30-minute, 40-minute drive over there and back to go play pool. And I have begun having conversations with my AI. And last night it was both ways, this long conversation about the Fed Reserve and the need for the Fed Reserve and post-Fed Reserve and pre-Fed Reserve. I know, fascinating. Well, that's fascinating to me. I loved every second of it. And so the access to that information and that real-world conversation to me is just fascinating. In your first question for the speed round, you're having a conversation with AI. If you had to pick one conversation, what would it be on?
If I had one discussion with AI, would be how do we help people better get along with each other? How do we help them facilitate stronger and deeper relationships? I mean, that's where I spend my whole day. But I don't think AI is ready to answer it yet.
Mm-hmm.
I think AI is. That's why I have a job, right? That it is so complicated because not everybody starts from the same place. But I think if we can improve that, because think of it this way. If you were on a subway and you had to hand your wife your wallet while you were fiddling with something, would you trust her to hold your wallet?
Mm-hmm.
But if there's a woman on the subway that looked just like your wife, would you hand her your wallet? You don't know her.
Right.
But she looks like your wife. What's the difference? The difference is you know your wife and there's trust.
Right.
That's what I'd want to get at. How do we get that, strengthen that trust? Because when two people, I don't care where you're from or what your culture is, trust each other.
Yeah, right.
Things get better.
Yeah.
They just get better.
that's getting worse, not better. And I think it used to be better, even when I was a kid in the 70s, like you said. You may have already given us this one leadership trait that scientists and technical founders must build or must have. One trait.
Social acuity, the ability to connect and show care and compassion. It's the number one trait in high performance. Okay. Social acuity. That's it. There's nothing else. All the data leads to it. It's the number one thing, which is why that's where I went with the AI. You can see my theme in my head all the time, right?
Yes. Yeah, great answer, though. I agree with that. That's a great answer. Common mistakes that innovators are making when they're pitching investors.
They're thinking that the investor cares about their technology.
Right.
You're sitting there thinking, if I could just explain to Jerry what my thing does, he's going to love it. And the investor's thinking, oh, well, this is the thing I always tell a CEO. You're going to pitch me on your new idea to cure cancer. Before you start to talk, Jerry, what's the one thing I know you're going to say? And I'm going to be right 100% of the time. I know about you at the very core of who I am. I know when you start to open your mouth, and I'm going to be able to predict it 100% right every time. What's that one thing?
I don't know. What?
That what you're going to tell me is going to be wrong.
Oh, yes.
I've never seen a budget. I've never seen somebody hit a budget, a timeline. I've never seen forecast revenue, right? Profitability. I know what you're telling me is wrong. I'm just trying to figure out how wrong, and can Jerry fix it before it becomes my problem?
Right.
And the innovator doesn't think that way.
No, all I got to do is get the investor to love this as much as I love it.
Right. And the investor doesn't care about it. They want to make money. They don't care if it's making money building houses, moving goods, or curing disease. They just need to make money.
A book or a mentor that changed the way that you lead?
I would say I'm going to give you two. I think Dale Carnegie, How to Win Friends and Influence People, should be a must-read for everybody. And we should start it in high school.
Isn't that fascinating? All those years ago, how right that was. How many people have been affected by that? It's fascinating.
Yep. Number two, I would say John Wooden's book on leadership. And if you don't want to read his book, watch his last TED Talk. He was 93 years old. It is a lesson in humility, lifelong learner, understanding what's important, having the right moral compass throughout your life. John Wooden, I think if people haven't studied him, you don't have to care about basketball to appreciate who he was as a man and a human being.
Yeah, I agree with that. Last question. If you're starting out, in your case, healthcare, I think you came out as an accountant, your younger self, what do you go back and tell your younger self when you're starting out, let's say post-college, getting into business?
Try not to fall in love with the business. Don't become emotionally tied to it.
Yes.
Put emotion behind it, but don't become emotionally in love with it. Mm-hmm. Meaning be rational about whether it's a good business or not.
Yeah, I love that. I've said forever, work passionately, but don't be emotional about it. I mean, being emotional about the work that you do, but don't be emotional about it. There's no emotion in good decision making. I only see bad decisions made when you're acting emotionally and you want to protect that thing that you built or you've fallen in love with it, to your point. So that is a great way to go out. Curtis, fantastic conversation. I appreciate it. It's fascinating. I hope other people find it as fascinating. I could talk to you for 2-3 hours, I'm sure, and we probably wouldn't even begin to touch what both of us would like to go through. But talking about Eureka Connect real quick, tell people, Institute for Biomedical Entrepreneurship, if they want to reach out to you, what message would you like to deliver to the folks that are going to hear this?
Look, if you have a company that needs help, I don't care how large or how small you are, we've helped all size companies. And we do it in a material way that's different than, and would love to talk to you. If you need help with your company, even if you need help in your personal life, we work with CEOs and working with their spouses and their children that, typically high school, college age before what we do really resonates. But we move the needle. And so EurekaConnect.com is our website. My assistant's Shauna Reed, S-Reed at EurekaConnect.com. And she'll set up a call with me and, be happy to talk to you about how we can help you. ibeinc.org if you're interested in a 5-day course on translation. And we've got programs upcoming and would love to learn more about your science and technology and how we can help you.
Fantastic. Curtis, great conversation. I really appreciate it, man. I enjoyed that.
Thank you so much, Jerry.
All right.
I appreciate being in front of your audience and your whole approach to this. It's well done.
Absolutely. I appreciate it. Thank you.